that's most likely the practical application. Whatever you wish to, but I think this will give us some idea to the other guys that where the actual disease is and how the ureteroscopy will be difficult. Secondly, if you see the blood supply, that's again important. In the lower part, you see the blood vessels come from lateral to medial to the ureter. So the medial aspect of the ureter is free. There are no blood vessels. Then this crosses, and then if you go towards the top, the renal area, so the blood vessels are towards the medial and particularly anterior. So ureter is the, you can say like the very posterior organ. So important anatomical aspects are, if you have a stricture and you're doing the ureterotomy, it should be medial in the lower part. In the upper parts, it should be on the left, it should be left or right, it should be the posterior lateral, and in the middle part, it should be the posterior. So these are the applied anatomical details from the urologist. Sorry. Next is, I'll show you some, you can say like, this is another video where I usually use the two, you can say like a guide wire for an access. So you'll see that this is access, this is the lower end, which is an intramural. This is where the tight ureter is. And then when you go in, so this is the negotiation. Okay. So here, the message is don't be, you can say like be gentle. So you will go and slightly, then there will be a you can say like peristaltic wave, and it will open up, and then you go slightly laterally and you will make your way. If need be, go for the shorter, lesser diameter of the ureteroscope. Standardly, we use a 6.5, but sometimes we have a 4.5. So that's how you go in. There is another impression, and then you go in, and that's how the ureter looks like from inside. So that's, and depending what type of a patient you have, either have a very big ureter, which will be very easy to access, particularly after a stent. Those who have no stents present acutely, you might have a tight ureter, but you might not be able to do the ureteroscopy. So, but that's acceptable. Next is, what are the other challenges in the ureter? We can have them. Anything can happen from the number wise and etc. But more importantly is the duplex ureters. So these are, you can say like either complete or incomplete, and if there is a complete, everybody should know the Weigert-Myers rule. So upper moiety draining into the lower, you can say like lower than the normal orifice, and usually that's abnormal. And the other duplex ureters are partially, which may be joining at the proximal, middle, or just near the bladder.